Hey there, everyone. Thank you so much for joining us. This is our first Catalyst webinar, and I think there will be many more of these. So I'm just happy to be here. I'm happy to be a little busier in the office. Of course, as a medical clinic, we've always been, super high strung about sterility and being clean. And so we are happy to take good care of you and keep you safe. So we welcome you back in, but remember, telemedicine is also an option too. But, Dr. Tonya and I were talking about things we've been hearing from our girlfriends and, kind of the struggles through lots of staying home and taking care of kids and, being a mom. And I actually have two different friends who have books by this same title, How Mama Got Her Groove Back. One of them is Rebecca Undum, and the other is Erin Day Cox. And so, I love that title, and definitely fits in to what we are excited to talk about with you today. So we are just making sure Dr. Tonya is cranked up in her office. I'm in our lounge in the clinical spa where we have patients wait while they have numbing cream on and such. But anyway, it's been pretty great to see patients coming back in, and of course it's great to have a little sunshine in the air, and yeah, it's just fun to be here, and we've got lots of good things to share with you. I'm waiting for Miss Carissa, our communications director. We're going to switch some slides up, and we're going to go to live screen so that you get to actually see our faces for a little bit, and then we'll kind of go through topics. We got several different topics we're going to talk about. The first one is going to be, how we're all feeling a little fluffy after being at home, and maybe having a little closer access to the refrigerator and the cupboards than we usually do. I hope a lot of people have taken time to do a lot more home cooking, and I've been hearing lots of great recipe suggestions, etc. We're also going to talk about your energy levels. We're going to talk about how jumping on the trampoline with your kids might be a little traumatic. We're going to talk about feeling hairy and sweaty and disheveled, and what we might be able to do to help you with that. And then we've got one more, but I can't remember what it is, but we'll get there. So we're going to move on to the next slide, and then we're going to jump right in, but we'll be live screening with you so you can see us as we talk. If you do have any questions, we will try to get to some of them during the presentation, and you can email them to wecare@catalystmedicalcenter.com, and we'll go from there. Do they also have a way to type in questions here? Yeah, actually, you can type it in through Zoom too. So if you want to do that, that would be great too, and we'll get them right away. So it works out perfect. But a lot of people have been mentioning how they feel like they have the COVID-19 version of the freshman 15. And as I mentioned before, lots more access. The kids seem to be hungry all the time, or if you're working from home, the refrigerator is, right around the corner, and maybe, maybe a little closer access than you're used to having. So we're going to talk about some options that you might be interested in checking out. And so, hey, Chris, I think we'll go back to live screen now, and Tonya and I will have a little conversation, and you guys can join in with us. So here we go to our shared screen. There, awesome. So several of you have met Tonya Loken, and she's been with our practice for the past 4 months, and it's been super fun to have her be a great option for our patients. And she's a naturopathic doctor, and she also is studying to get her nurse practitioner degree. So, you know, she's kind of jumped through a lot of hoops in order to be working on that. You know, she's still doing clinicals. She shadows with Taylor Fontaine, our physician's assistant, and our dermatology nurse practitioner, as well as me. And so we kind of are having a nice blend of both the traditional medical world and functional medicine, which I practice as well in my realm. But she's got some additional training in nutrition and you know, also some insights from the naturopathic world. So I think it's a great blend of services, and so we're delighted to have her with us. And so you know, Dr. Tonya is a pretty local girl, but she went away for lots of training, and now she's been back. She had her own practice called Spark, but now she is a big wonderful part of the Catalyst team. And so it's been great to have this this team approach. And you know, we have a few differences of opinions, but we are working through them and kind of giving a united front in terms of what is the best options for our patients. So with that, I'm going to just mention a couple things that I'm really interested in, and then Tonya's also going to talk a little bit about our capabilities for food sensitivity testing and how she can help develop some personalized meal plans too. But you know, we've been working with food sensitivities and allergies for a long time, and you know, I'm a firm believer that food is medicine. I have, you know, I've struggled with my weight my entire, well, probably not when I was like 9 or 10, but I remember being conscious of my weight at an early age, probably 11 years old, even when I was, you know, not a, you know, I was a very normal weight, but I had a little sister who was like a string bean, and, you know, I just don't have the body type of a string bean. So when I was compared to the string bean, of course I looked heavier. And so, you know, I was always conscious of that. You know, it definitely played a kind of a negative role in terms of, you know, growing up and always feeling self-conscious. So, you know, there's lots and lots of different, you know, dietary options out there. You know, I definitely don't want to suggest that people, you know, I think the most important thing is just focusing on eating well, not focusing on counting calories. You know, I definitely think there's some foods that are, you know, more beneficial for you than others. And that sometimes timing of your meals can be important. One thing I'm a big fan of a plan called the Whole 30. And it's a plan where basically, you know, you strive to eat whole foods, you avoid processed foods, you avoid sugar, alcohol, you know, things that are like baked goods, and you focus on, you know, fruits and vegetables and good quality protein. There's lots and lots of choices. But basically, it's kind of like a 30-day elimination diet. And so you really can figure out what works best for your body. As I mentioned, we do lots of food sensitivity testing, which can be helpful as well. But, you know, this kind of is something that really streamlines things for people. You know, it's like you can definitely do it for 30 days and then add things back in one at a time. So you get to figure out, is dairy bothersome to your system? Is wheat and or gluten bothersome to your system? Certainly, we know the trials and tribulations of having a, a problematic high sugar diet, and we're trying to get everybody to avoid that. But anyway, I think of the Whole30 like a really good elimination diet, and kind of almost like a cleansing of your system, so that you really can tune into how your body feels and how you can optimize the foods that you put in to fully support your energy system. There's one other system that I'm also a big fan of for if somebody's looking for a more short-term jump start, and that is a system called the fasting mimicking diet, which is based on the work of Dr. Walter Longo. He's Italian. I'm kind of prone to Italians, as some of you might know, since I've had 2 exchange students from Italy, and I've taken a wonderful trip to Italy several years ago, and still have fond memories of that. But it is really condensed down so that it's a 5-day food plan, and then with some kind of intermediate steps after that. But it really, you get between 750 and 1100 calories a day, but and it really also helps cleanse your system and help you figure out what works for you. And it's equivalent to actually doing an extended fast. They found a lot of really interesting scientific data regarding this diet, and it's actually one of the best studied fasting systems out there. And basically they had, for example, a group of diabetics, and they followed them very closely over a 6-month period, and they did a 3-month period where 5 days a month they had them do this meal plan, which involves basically lots and lots of water, and small but satisfying breakfast bar, and then some olives, and there's some, a couple days have these kind of grainy crackers that aren't really grain based, but they're seed based, and then soup, a really satisfying soup for lunch and dinner. And anyway, it's kind of it's like you don't really feel hungry while you're on it. You really can power through. I might even try it as a lead-in to the Whole30 diet one of these days. But anyway, the research on these diabetics showed that they did this just for 5 days a month, and then they resumed their regular eating plan the other 25 to 26 days of the month. And but they measured their numbers after that 3-month period, and they had significant improvement in their hemoglobin A1C, which is the marker that we use. Basically gives us a 3-month tracking of how your blood sugar has been. So it's the fact that just 5 days of eating in a modified fasting fashion can make long-term gains for you over a several month period of time, and these improvements were maintained. So it's really a neat system, and kind of fits into trying to find things that work for particular people. It's a great option too. So with that, I'm going to let Dr. Tonya talk a little bit more about food sensitivity testing that we have available, and how she can also help you figure out what plan works best for you. So take it away, Dr. Tonya.
Thanks, Dr. Sue. I just want to reiterate, I love the Whole30. There's so many resources. And so that's awesome because it's been out for a while, and you can find every modification under the sun. If you want, your favorite Italian food, or you can find the recipe in Whole30 version. So I love that. food sensitivity testing is unique because it doesn't seem like many people are aware that they can eat healthy food, right? And I'm going to put quotes around healthy food because that food might not be healthy for you, right? Your body might not like that food, and that might actually be causing you to gain weight, maybe water weight, maybe just that puffy, fluffy feeling. Because it's broccoli, because it's onions, because it's, dairy or gluten or eggs. And we won't know that until we actually see how your immune system is responding to those foods that you're putting into it, right? And so that's why I love food sensitivity testing, right? I get people in all the time who say, oh, I'm eating all the right stuff. Well, let's make sure you're eating the right stuff for your body. That might take away things like joint pain and headaches and migraines and these kind of low level symptoms that we just tend to deal with on a daily basis that might make us feel more sluggish and just not feel the best. When we can do a simple blood draw or a finger stick and say, Dr. Sue, wow, you are, your body is really reacting to all of these healthy foods you've been eating. Let's cut them out for a little bit and see how you feel. And people will report changes in their weight, over the course of, even just a small week, right? They'll have changes in their weight. They'll have changes in their sleep, their skin, their joints, their energy levels, their brain fog. And right now, with our moms doing all of the things at home, schooling, their work, housework, all the things, keeping everything together, we definitely need those brains to be turned on and active. So that's my plug for food sensitivity testing and making sure that we've got the right foods coming in with the right nutrients and without causing inflammation in our bodies. The other thing you mentioned that's interesting is the kind of personalized meal plans. I know there's everybody out there is like, I don't like this thing, I don't like that thing. How can I make these healthy meals that my family likes, my kids will eat, and that my husband won't turn his nose up at, right? And so I think that, sitting down with a patient and saying, what do you like? What don't you like? Now let's come up with, a week or two, or maybe even a month's worth of ideas that you can rotate through that are easy, that don't take a 5-course, chef meal plan to get through, so that you feel like you're eating healthy foods that are making you feel well nourished, but also energizing you, and also making you feel like you said, like you're not starving, right? I think that's a big thing. When people say, oh, I'm going on a diet, they automatically think I'm going to starve myself. And with Whole30, and I mean, I've done Prolon, I've done Whole30. I love both of them, and I don't think you need to starve to eat healthy and feel good.
I agree. Yeah, thank you. Thanks. And, actually, this is a good time maybe to talk about like how you do your appointments. And so, kind of what you go through. I know we've got a question about libido and hormones after and during and after menopause, and we will be getting to that. But just it's like, even when people come to us for like specialized things like allergy or sinus stuff, we try to take that whole person approach. But Tonya kind of is able to, with her, we have naturopathic visits with her. And so I'll have you tell them a little bit about, how you interact with new patients. And I know they have to do a little bit of homework and, kind of do a deep dive thinking about, lots of different things related to their health and what you talk about in a new patient visit, and then how you do your follow-ups. Sure.
That's really great because, even though, I might see patients that are very similar to Dr. Sue and Taylor, often maybe my lens is a little bit different, right? And I think that's great. Like, I love to refer and make sure that everybody's getting this kind of whole person approach like you talked about. But right away from the bat, I'm going to ask you to really fill out some paperwork that's going to allow me to understand everything that's happened to you, maybe even back to from when you were born until I see you today. In naturopathic medicine and philosophy, we really think that, all the way back to when you were born, maybe even in utero, what was going on in your mom's life and in your life as a baby really affects who you've become as an adult. And so I like to deep dive into those things. I'll try to pick your brain to make sure that you can remember how many antibiotics you've had as a kid, what kind of surgeries you've had, what kind of illnesses you've had. And then also thinking about things like exposure. What's your exposure to heavy metals or to environmental toxins? And so really getting into the nitty gritty of what you do on a daily basis plays a role into your health here sitting in front of me. In addition, I also like to talk about diet at every visit. What are you eating? What are you putting in your mouth? What's your stress like, right? So I really do a big head to toe, what's going on? What are we missing? Because, just like you've learned in your functional medicine training and through all of your integrative trainings, everything is connected. And so I don't like to kind of piece things out. When you are here with me, we spend an hour together for our first visit. We spend 30 minutes together for our visits after that. And we really just look at every single puzzle piece of your body as a whole puzzle. In addition, if you haven't seen a naturopathic doctor, I do functional lab testing, meaning, regular blood draws, but also stool samples, food sensitivity testing, hormone testing, saliva testing, that you might not get elsewhere. And so I think that's a really unique piece here at Catalyst, is that we're doing some of those functional medicine testings that you're hearing from big name doctors in the functional medicine world, and you can get them here.
Great. Yep, we're happy to have you. So we're going to go on to our next topic. And so I need to have Chris's help because I suck at this kind of stuff since I haven't done it before. So I'm so grateful for her help. So there we go. Awesome. So we'll go on to talking about our next thing. So I'm gonna, we've already talked a little bit about healthy lifestyle, and I like to use this framework of, and it might sound a little familiar, but it's got a few twists to it. And mine is eat, move, sleep, pray, love. And obviously we've already talked about using food as medicine, finding out what works best for your body. Movement, we all know we should be moving a little more. Hopefully you've taken the advantage of having a little bit more time to do some walks with your family. Maybe you lift weights a couple times a week, and maybe do some, joyful movement like dancing. I know there's a few things going on online. I know through the Giving Hearts Day site, they're encouraging people to do some crazy dancing for their favorite charity. So I'd love to have you check that out. But yeah, it doesn't have to be like, running 5 miles. If you take a 30-minute walk every day, you're going to be, so much ahead of the ball game. It helps so much for your mood just to move. And two, if 30 minutes is too much, you can do 15-minute walks, but just make sure that you're you're getting up and adding some movement to your life, because it is so important. Ideally get your heart rate up for a certain period of time. A lot of people are into like interval training, where you try to sprint to the neighbor's house as fast as you can, and then you walk, and then you can sprint and then walk. Or you can do jumping jacks do 20 jumping jacks and then just march in place. And so there's so many fun little exercises that you can even do, like an interval training where you get some high intensity work. You can do like a 12 to 15-minute workout, even 3 times a week, and that's going to be enough for your cardio. So it's super important to remember movement. And one other thing, since we're working from home and kind of not in our usual setting, make sure you're not sitting too much. If I know maybe you have a standing desk at the office, but and you probably don't have that at home. But if you have a kitchen island where you can stand up and work from your kitchen island, but just make sure you're not sitting too much. Try to get up and move around at least for 5 minutes every hour, even if it's just standing and stretching. But don't sitting for 8 hours straight can be as deadly as cigarette smoking. So it's movement is super important for us too. And then I'm also board certified in sleep medicine, and so you know, I also hope that you've had a little bit more time to focus on your sleep. You know, there's certainly some really interesting, you know, ways of maximizing your sleep time and really relaxing. You know, Tonya's going to talk a little bit more about hormones, but progesterone for women who are kind of maybe, you know, easing toward menopause or postmenopausal, progesterone can really be helpful with helping us sleep better at night. I'm personally on that, and it's made a world of difference in my sleep. Making sure you're sleeping in a dark, cool room. Get your room as black as possible. That's very, very important. You know, it's like somebody was commenting on the site next door about these beaming lights into the sky. There's a new development out in West Fargo called the lights, and it makes me sad because we have so much light pollution that, you know, unless you have blackout drapes, you know, even, you know, at 3 a.m. you're going to be, you know, you're going to be getting that ambient light that's coming in from outside from our street lamps, etc. So, you know, the fact that they're beaming skylights into the air, I think, is light pollution, and it really affects wildlife too. So, so remember, really, really dark. You know, if you have to have a night light for going to the bathroom, make sure it doesn't have any blue light. You know, make sure it's like an orange or a red color, because seeing blue light in the middle of the night can kind of tripwire your pineal gland and kind of screw up your melatonin metabolism, which can make things harder too. You know, kind of moving on to praying. You know, it's like, you know, whether you believe in God or a higher power or not, we know that there is something so beneficial for our neurologic system about, you know, finding some peace and calm, whether that be meditation or prayer. You know, it really can go a long way with being more mindful and enjoying life more. You know, I'm kind of a blended, you know, my foundation is Catholic, and I went to Shanley High School here in town, and but my son's dad is very, very Lutheran, and so I had to compromise a little bit. And so I've taught Sunday school at Hope Lutheran for a long time now, and you know, there's Luther, you know, Hope Lutheran has some excellent music, so I really enjoyed that. But you know, it's you know, for me, having faith is very important. But whatever works for you in terms of you know, finding that peace and quiet in your life, and making a connection that kind of, you know, soothes your soul. And lastly, love. You know, I hope that you've had more time to enjoy your family. I've heard that, you know, although homeschooling is super hard, kids are just loving being more connected to their parents. I just love seeing all the creative projects and, you know, love and support that people are lavishing on their children and their family, even sometimes from a distance. We know that connection is extremely important to our health. You know, I mentioned that sitting all day is as bad as cigarette smoking. Well, loneliness is worse than cigarette smoking for your health. And so, you know, even if it's, you know, Zoom happy hours, you know, it's important to, you know, be intentional about connecting with others, and, you know, enjoying some deeper conversations than perhaps you've had time for in the past. But, you know, it's also, you know, that support and knowing that, you know, you're not alone in this world. Even if you might be, you know, at home alone, you know, make sure to be intentional. And you know, if you need help, don't be